Day 14 of Learning Exercise Therapy. A patient rehabilitating from knee surgery is examined in physical therapy. The patient's involved knee range of motion begins at 15 degrees of flexion and ends at 90 degrees of flexion. The total available range of motion for this patient is 75 degrees. A patient is able to actively hyperextend the right knee 5 degrees. Assuming the patient's total range of motion of the knee is 65 degrees, which of the following recordings will be the most representative of the patient's actual range of motion? Answer 5060. A therapist instructs a patient diagnosed with rotator cuff tendinitis in a home exercise program. The most important consideration when designing a home exercise program is to focus the program on the individual needs of the patient. A patient rehabilitating from a spinal cord injury works on self range of motion activities in sitting. Suddenly, the patient begins to demonstrate signs and symptoms of autonomic dysreflexia. The most appropriate therapist action is to keep the patient in sitting, monitor the blood pressure, and check the bowel and bladder for impairment. A therapist palpates proximally along the second metacarpal. Which carpal bone does not articulate with the second metacarpal? Answer: hamate. A therapist palpates the proximal row of carpals in a patient diagnosed with carpal tunnel syndrome. Which of the following bones does not articulate with the proximal row of carpals? Answer: ulna. A therapist develops a physical therapy problem list after completing an initial examination on a patient diagnosed with right shoulder impingement. Which of the following entries will not typically belong in the physical therapy problem list? Answer: increased stress secondary to financial problems. Day 14 of Learning Exercise Therapy. A patient rehabilitating from knee surgery is examined in physical therapy. The patient's involved knee range of motion begins at 15 degrees of flexion and ends at 90 degrees of flexion. The total available range of motion for this patient is 75 degrees. A patient is able